How do you deal with knee pain when cycling? What's up, everybody? This is Mario, and today I want to talk to you about how I'm dealing with some knee pain that has developed from cycling. So, as you know, I've been cycling a lot due to how much fun I'm having with Zwift, and I think I've honestly overdone it. And I think that that's resulting in some of the knee pain that I'm having. And I've never really had any knee pain before that's due to cycling. I have had issues when I'm running and I'm, doing longer distances. But this all kind of started on Thursday. I was doing a Zwift ride with one of my friends and one of my coworkers. And it was about 40 minutes into the ride towards the end, and we were going up a hill. And all of a sudden, I started to feel this kind of sharp pain when I was pedaling, and it was on my right knee in the front of my knee. And once I realized that, I realized that it was probably time to slow it down and get off the bike. So I just kind of pushed through for the last 5 minutes, and then I told him, that I needed to drop off. And so since then, I've taken Friday and Saturday off, and I just tested it out this morning, and I was hopeful that just a couple of days of, resting it would result in it being okay, but I'm still having that pain. And so I'm actually pretty bummed about it because this morning I was supposed to do a group ride with three of my best friends, and I had to skip out on it. So I'm definitely feeling a little bit of FOMO. And nobody likes to be injured or to have to sit things out that we enjoy and that we look forward to. But what I wanted to do is I just wanted to share how I'm approaching dealing with this knee pain and a few things that I'm learning along the way, because I started doing a lot of research this morning on what are some of the causes of knee pain, how do you treat it, and how do you, get over it. And so I just wanted to share a few of those things with you today. So the first thing to know, if with knee pain and cycling, is that it's super common. So most cyclists, from beginners to the pros, will experience knee pain when cycling at some point during their riding career. So that's you. If you're getting into triathlons, you're getting into biking, you're going to deal with this eventually. So maybe you're not dealing with it right now, but pay attention to this, because this is going to be helpful once you do encounter some of that pain. So in terms of it being really common, there was a study of 116 professional cyclists, and it found that 94% experienced some sort of overuse injury over the period of a year, and 23% reported knee pain specifically. So even though those were professional riders and they're dealing with much longer distances and more intense sessions, the same is going to be true for you and me. The longer that you get into this, the longer the distances that you're doing, and the more time that you spend on the bike, the more likely it is that you're going to deal with this injury. And so once you kind of realize, okay, this is super common, another thing that you need to think about and you need to identify before you start to treat it is to realize and understand what kind of pain you have and where it's specifically coming from. So there's all of these different ones that I'm going to go through. So the first is anterior knee pain. That's pain at the front of the knee. There's posterior knee pain. That's pain at the back of the knee. Then there's lateral and medial knee pain at the side of the knee, kind of the inside and the outside. And then there's knee pain as a result of weakness in the core, and then spring knee pain. So I'm going to focus on kind of the first two because those are the most common. And so with the first one, anterior knee pain at the front of the knee. When I was doing this research and I saw that this was one of the first ones that popped up, I'm like, yep, that's me. And so this is pain at the front of the knee, and it's very common. And according to the research, it is usually caused by tightness in the quads or the fibrous tissue that runs alongside the outer leg, the iliotibial band, the IT band, that pulls on the patella, which is your kneecap. So just to repeat that, it's usually caused by tightness in the quads or tightness in the IT band that pulls on the patella, which is your kneecap. And it could be down to bike fit or tightness as a result of that maintenance or overuse. And when I saw this, I thought, yep, this is 100% me, because I am not the most flexible individual. I actually really don't enjoy stretching. I'm not very good at it. But the same thing happened to me when I was running and when I was training for my first ultra marathon. I was running and really building up my mileage, and my IT band got super tight and it caused knee pain. I also ran into the same issue when I was training for my Ironman, and my tight IT band made me have knee pain that forced me to stop running for 3 to 4 weeks. So I understand how important the IT band is, and how not stretching and how not being flexible can result in these injuries. And this article that I was reading was talking about how one of the scientists that was looking at the study was saying that some cyclists have quads and IT bands that seem to be made of steel. And I completely resonated with that, because when I was stretching my IT band, it was so tight. It did literally feel like steel. And that's a good sign that it's something that you need to stretch and something that you need to foam roll. So if you're not familiar with foam rolling is where you take basically this hard roller and you just rub it over the given area that has the tight positioning, and you slowly roll it and basically massage your leg to the point where it kind of breaks down some of the muscles and the fibers, and it's supposed to start that healing and recovery process. So that's one thing to be aware of. The other thing that they talked about is bike fit. So this is now kind of getting into how to fix anterior knee pain. I'll just go through these quickly. The first is to kind of check your bike fit. The second is to foam roll. And then the third is to stretch. So when you're dealing with pain at the front of the knee, first, it's a good idea to check your bike fit, because pain in the front of the knee often comes from your seat being too low or too far forward. So that's something to think about, because if your seat is too low, then it's going to put more pressure on your quads and on your kneecap. And I think that's something that I am dealing with. The other thing to think about is to look at the foam rolling of the quads, the thighs, and the IT bands. That was the one that I was touching on previously. You definitely want to stretch those areas. And then the other one is just to stretch and to build out your core strength, because the whole body is connected. It's not just your knees, and it's not just your thighs and your quads. It's your whole core. It's your glutes. It's your lower back. So doing some yoga, doing some stretches to strengthen those areas will actually help with this knee pain. So that's something to think about if you have the anterior knee pain. And those solutions are check your bike fit, foam roll the quads and IT bands, and then to stretch. So, but what happens if you're having pain at the back of your knee? This one is also due to your bike fit, but it's actually the opposite. So if you have pain in the back of your knee, it likely means that your seat is a little bit too high. And when your seat is a little bit too high, it means that you're extending your leg a little bit longer than it should, and you're forcing your body to pull up on the pedals, which puts more pressure on the hamstrings. And when that happens, that's when a hamstring muscle that's connecting to the back of the knee, that's where that can get injured and that can get overused. So kind of the saying that you should think about is pain at the front of the knee means that your saddle or your seat is too low. Pain at the back of the knee means that your saddle or your seat is too high. So the first thing to think about is to look at your bike fit. In addition to kind of stretching and foam rolling, like I mentioned before, one thing that they mention for the posterior knee pain is just icing. And icing for 5 minutes every hour can really help. And then stretching and foam rolling is another key area. So that was just a little bit on the anterior knee pain, the posterior knee pain, and after all of that research, it's basically this question of, okay, how am I going to try and treat and rehab my anterior or front of the knee pain? Basically, this is my plan after reading through it. So the first thing I'm going to do is I'm just going to take a week off and just let my body recover. That's the hardest thing to do when you're looking forward to something and when exercise is such an important part of your daily routine. But the most important thing is to stop doing the thing that is causing you pain in the first place. It seems obvious, but it's really not that easy to follow through on sometimes. So that's the first thing I'm going to do, just take that week off. Also, the next thing is I'm going to be looking at my bike fit. So since I have the knee in the front of the knee, I'm going to look at maybe raising my seat up slightly so that I don't have as much pain and pressure on my quads that are causing the front of the knee pain. So looking at my bike fit, going to raise my seat up slightly. Third thing I'm going to do is I'm going to start foam rolling and stretching daily. So I'm going to be foam rolling my quads, my inner thighs, my IT bands, lower back, calves. Basically just going to try and really stretch and foam roll out my whole body. Next thing I'm going to do is I'm going to try and strengthen my core and my glutes. So going to be doing some core exercises, kind of like yoga type of things. I'm going to be doing some hip bridges, some lunges, different things like that. And I'm going to need to do a little bit of research. I haven't done a lot of exploration on that yet, but I can share some more of that once I dig into it. And then once I've done, all of those things for a week, I'm going to test it out I'm going to jump on the bike and just test it out like nice and easy and see if I still have that pain. So this is kind of how I'm approaching it. Just to recap, going to be taking a week off, going to look at my bike fit, raise my seat height slightly. I'm going to foam roll and stretch, and then I'm going to work on strengthening my core and my glutes. And then I'm going to do a small test in about a week. So I'll give you guys an update on how this goes. It's definitely a bummer, but in the grand scheme of things, this is a minor setback. My next race isn't really until June, so I've got plenty of time to recover, get back in shape, and feel better. And I do actually view this as a good thing because I'm a big believer that whenever there's an injury, it signals that there's an issue with the process that you're following in order to try and get to a result, right? So let me say that again. Whenever there's an injury or there's an issue, it signals there's an issue with the process that you're trying to follow in order to get to a result. So this was an issue. I'm having this knee pain because I'm not stretching, because I probably have an improper bike fit, and because of some of the other things that I mentioned, then likely just because I've been biking too much and overdoing it. So that's an issue with the process that I'm going through and trying to get to that result. And I think the same thing happens with us in other areas of our life. The same things happen at work. So let's say somebody on my team makes a mistake and they don't update somebody else that they need to at the appropriate time. I don't actually view those as a personal issue, and I don't try and blame that individual. I view that as a process issue. That to me is a signal that I haven't made it clear in the process that we follow that that's what they're expected to do at a given point in time. So something I want you to think about is the solutions are in the process. And when you fix the issues in the process, then good things happen. So definitely a setback, but in the long term, I view it as a good thing. And I hope that was helpful for you today. And I hope you all have an amazing day.